Hi, let's talk about HPV. So what is HPV? It's known as human papillomavirus, and it's a group of more than 150 related viruses. HPV is named for the warts or papillomas some HPV types can cause. Some other types of HPVs can lead to cancer. Let's talk about 3 very important reasons you should know about HPV. Reason number 1, it's a sexually transmitted disease that many people have and most don't even know. Actually, about 80% of people will contract some form of HPV infection in their lifetime, and there is no cure. So, reason number 2, HPV is transmitted through intimate skin-to-skin contact. That means you can get HPV by having vaginal, anal, or oral sex with someone who has the virus. But it's most commonly spread during unprotected vaginal or anal sex. Reason number 3, HPV can be passed even when an infected person has no signs or symptoms. In most cases, HPV does go away on its own and does not cause any health problems. But when it does not go away, it can cause health problems like genital warts and cancer. You might be asking yourself, what types of cancers can HPV actually cause? And the answer is a lot. HPV can cause cervical, anal, rectal, vaginal, vulva, penis, and throat cancer. Okay, so let's talk about some things that can increase your risk for contracting HPV. So we know college is a time for studying and learning, but it's also a time for making friends and meeting new people, maybe even start dating someone new. But it's important to be aware that having an increased number of sexual partners can also increase your risk, especially if you're having unprotected sex. That doesn't mean just you. If your partner or the person you're having an intimate or sexual relationship with is having an increased number of sexual partners as well, this also increases your risk for contracting HPV. Some other risk factors include being immunosuppressed or having a weakened immune system, and you or your partner not being circumcised. So I'm sure the big question on everybody's mind is, how do we prevent HPV? So how can we prevent HPV? Regular condom use every time, limiting your sexual partners, abstinence, that means having no sexual activity, mutual monogamy, that means having sexual activity with only one partner, and getting the HPV vaccination. Typically, routine HPV vaccinations are given when you are about 11 to 12 years old for both boys and girls, but it can be given as young as 9 years old all the way up to 26 years of age. A 2-dose vaccine schedule is recommended for girls and boys who initiate the vaccination series at age 9 to 14 years old. The 3 doses are recommended for teens and young adults who initiate the series at ages 15 to 26 years old and also immunocompromised people. Maybe you started your HPV vaccine series when you were younger but never finished. It's important to go back to your provider and finish your 3-dose series because HPV vaccinations can prevent over 90% of these cancers from ever developing by preventing the infections that cause those cancers. Alright, let's play a game called Myth or Fact. Myth or fact. Only women get HPV. Myth. The fact is, men get HPV too. In fact, most sexually active men and women will have at least one HPV infection at some point in their lives. Myth or fact. If you don't have sex, you won't get HPV. Myth. HPV can be spread through skin-to-skin oral, anal, and vaginal sex. Condoms can lower your risk, but you can still contract the virus through protected sex if there's skin-to-skin contact. Myth or fact. I got the HPV vaccine series, so I don't need to get any pap smears. Myth. The fact is, even if you get the HPV vaccine series, you still need to get regular pap smears to screen for cervical cancer. The vaccine is a preventative measure and doesn't cover all HPV strains. So now you know what HPV is and the types of cancers they can cause. It's important to remember how to reduce your risk factors and to remember to get the HPV vaccine series to protect yourself against those cancers. For more information, visit cdc.gov/HPV.